Hello guys, another topic from the Vital Science unit for B.Sc Nursing and GNM students. It's a respiration. We have discussed about normal respiration, and in this class I would like to discuss about abnormalities of respiration and in which condition what kind of respiration can be seen. In this class we are going to discuss. It is a several times asked question for 5 marks for B.Sc Nursing students in the fundamentals of nursing. Please go through this. So here, when I want to speak about abnormalities in the respiration, normal respiration already we have discussed. It's ranges from it can be 16 to 20. In some conditions it can be 23 also. So there are if it is lower than the normal level or more than the normal level also, we call it as a abnormal respiration. So first of all, we should know that what is tachypnea, what is bradypnea. So tachypnea itself is a the respiration is more than normal. Tachy more than normal. Bradypnea means when respirations are lower than the normal, then we call it as a bradypnea. These two conditions we should understand here. Apnea and all the terminologies we are going to discuss in the next slides. So here we see apnea or suspension of breathing. We can say cessation of breathing, we can use the word cessation of breathing when a person may be having a long gap when taking the respiration. That condition we call it as a apnea. It's a suspension of breathing and no movements of muscle respiration, like a person may hold like this. So that kind of state we call it as a apnea. And next condition is, so you can see apnea can be achieved maybe because of voluntary breathing holding, sometimes mechanical, or sometimes from the neurological trauma also. Already I said that sometimes if you go to water, we hold the nose like this. Then we intentionally we hold the breath for some time. That's we call it as, it can be a voluntarily or involuntarily or maybe mechanical or due to neurological disorders. That's condition call it as a apnea. And next one is, you'll see here tachypnea. Already I said the respiration will be between 16 to 20. When respirations are more than 20 in 1 minute, we call it as a tachypnea. So increased rate of breathing, that is more than 20 breaths per minute. It is characterized by rapid shallow breathing. It is seen in following conditions like fever, compensatory respiratory alkalosis, respiratory insufficiency, lesions to the respiratory centers in the brain, and elevated diaphragm. So these are the conditions usually the tachypnea will be noticed. And when we see other conditions, like already we have mentioned bradypnea, this is another terminology. Here decreased rate of breathing when it is less than 12 breaths per minute, we call it as a bradypnea, and characterized by shallow slow breathing. Shallow and slow breathing will be there. It is seen secondary to the following conditions like diabetic coma or respiratory depression or increased intracranial pressure. When there is an increased intracranial pressure or respiratory depression, this kind of respiration can be noticed. When it is less than 12 breaths per minute, we call it as a bradypnea. Hyperventilation. Hyperventilation means it is characterized by rapid and deep breathing. Hyperventilation means it's mostly caused by increased levels of CO2. When carbon dioxide levels are high in your body, then this hyperventilation condition we can see. When the rate and quantity of the alveolar ventilations of carbon dioxide exceeds the production of carbon dioxide. So other causes includes like anxiety or pain or any COPD or obstructive disorders. Just I can say like hyperventilation means deep breathing. Person may take breathing like this. So this is mostly in case of tension. Suddenly when you heard any kind of information from people like father expired or mother expired, that time you are like anxiety and tension. In that conditions usually you can see this kind of hyperventilation. And even sometimes you may notice in the COPD also chronic obstructive pulmonary disease. This is another type. Okay, next one is we have already discussed tachypnea, bradypnea, apnea, then hyperventilation. And this is another one, we call it as a Chinese strokes breathing. Chinese strokes breathing, it is also called as a periodic breathing. It's characterized by alternative periods of tachypnea and apnea. It can be more respiration, or sometimes suddenly uh, breathing may be cessation, means less breathing also will be there. So it occurs as a compensation of changing in the serum CO2 and O2 levels. It is classically seen in damage to the pons where respiration centers are located. Especially these kind of Chinese strokes respiration, you can see in the stroke when person become a coma, or when a person get any injury in the small brain area and traumatic brain injuries, or in case of heart failure also we can see Chinese strokes respiration. So this is what we can see. When they breathe rapidly and they give a gap, and after that they start breathing. So that's call it as a Chinese strokes respiration. And next one is kusismal breathing. Kusismal breathing means it's a rapid, gasping, and very deep type of labored breathing. We can see this is also called it as a air hunger. Kusismal breathing usually we can see when you climb 5 6 stairs at a time. In that condition, maybe your lungs are not supporting with a good oxygenation. You may be having a either maybe normal like shallow breathing, or sometimes deep breathing also can be there. Shallow and deep breathing can be seen. So that is called kusismal breathing. And overall this image will give you a complete abnormalities of the respiration. Tachypnea will come be like this. Like this the sound will come. Bradypnea means the waves are very less, that means inspiration and expiration numbers are automatically declined or decreased. Apnea means no breathing. Then Chinese stroke respiration, already I said, it's like mostly some rapid breathing tachypnea stage, and some stages apnea, and again tachypnea, like that the stages will be there. And kusismal respiration will be again deep and rapid respirations can be seen. This is a different kinds of abnormalities in the respiration. So thank you for watching. If you really like my class, please do subscribe, and you can use this content for the notes also. Thank you.